What happens in a huge country like the United States when the internationally respected government agency for public health information and guidelines begins to crumble? That's what many now former directors and scientists from the CDC say has happened since Robert F. Kennedy Jr. took over as head of Health and Human Services. That's the umbrella U.S. government agency which houses the CDC, the FDA, the NIH, and many more divisions involving all aspects of American health and healthcare. I'm Stephanie Shelton, and I host the podcast Conversations on Health, How We Get There. And in episode 40, which drops Tuesday, January 20th, mark that day, we'll be talking about some of the changes at the CDC under RFK Jr., what they mean to us ordinary Americans, as well as to the rest of the world. And specifically, we'll talk about the newly updated and quite controversial child vaccine schedule with our special guest, Dr. Daniel Jernigan. He's one of the highly placed CDC officials and scientists who resigned en masse last August because they couldn't ethically and scientifically do the bidding of RFK Jr. Dr. Jernigan is a nationally recognized public health leader with more than 30 years at the CDC, where he directed the National Center for Emerging and Zoonotic Infectious Diseases and the Influenza Division. He's led responses to major health crises including anthrax, SARS, H1N1, Ebola, MERS, and COVID-19. And he's authored over 160 scientific publications. Now, if you want facts on where diminished vaccine use will lead us and what we can do now to stay healthy, you'll want to pay attention to this episode. Again, it will drop Tuesday, January 20th.